Today we'll learn about the Partograph and how it is used. So the Partograph is a tool used to monitor the maternal and fetal well-being during active phase of labor. And the purpose is to monitor and provide an accurate record of progress of labor so that any delay or deviation from the normal may be detected quickly and treated accordingly. And now components of the Partograph. We have mother or patient information. This is the top part where we record the name, the gravida, the parity, hospital number, date of admission, time of admission, and time membrane is ruptured. So the second component of the Partograph is fetal well-being. So under fetal well-being, we check for the fetal heart rate, the state of membranes and color of liquor, as well as molding. The third component of the Partograph is progress of labor. Under this, we record the cervical dilatation, the descent, and the contractions. The fourth component of the Partograph is medications. This is where we record drugs given, including oxytocin and fluids. The fifth component is maternal well-being. This is where we record the blood pressure, the pulse, temperature, and urine analysis. Now details on how to use a Partograph. Before using a Partograph, you need to carry out all the investigations and observations as soon as the woman enters the labor ward, as these findings will determine on how and whether we use the Partograph. After the examinations, if the mother is in active phase of labor, then the Partograph can be opened and findings are recorded, starting with the patient or mother information, where we record the name, gravida, parity, date of admission, time of admission, and time membranes ruptured. Then I will first record the cervical dilatation on the alert line, as this will guide me on where to record the time. For example, 5 centimeters cervical dilatation will be plotted here, and descent will be plotted here with a circle. Cervical dilatation and descent are recorded after 4 hours. After recording the cervical dilatation, I will record the time on the vertical line along with the cervical dilatation, starting with the time of admission, which is 01 AM in a sequence. After recording the time, now we can enter the hours. Hours are recorded from the first vertical line on the Partograph in a sequence, regardless of the cervical dilatation, as this refers to the time elapsed since onset of active phase of labor. Amniotic fluid is recorded after a vaginal examination, with an I indicating membranes intact, a C indicating membranes ruptured with clear liquor, M indicating meconium stained liquor, B indicating blood stained liquor. For example, this client has intact membranes and so we record I. Molding is also recorded after a vaginal examination, recorded with a 0 indicating no molding, a 1 indicating sutures are post, 2 indicating sutures overlapped but reducible, and 3 indicating sutures overlapped and not reducible. For example, there is no molding and so we record 0. Now we can record the fetal heart rate. Fetal heart rate is recorded every 30 minutes, counted for a full minute, observing the strength and rhythm of the beat. Fetal heart rate is recorded using a dot with an R indicating regular and an I indicating irregular heart rate. For example, fetal heart rate, which is 130 beats per minute, regular, will be recorded here. Now we can record contractions, and this is done every 30 minutes, counting the number of contractions in 10 minutes and their duration in seconds. Mouth contractions lasting less than 20 seconds, shaded with dots. Moderate contractions lasting 20 to 40 seconds, shaded with stripes. And strong contractions lasting 40 seconds and above. These are completely shaded. Each box represents a contraction. Now, for example, she has moderate contractions and so we'll shade with stripes. Now we record the maternal vitals, starting with pulse. Pulse is recorded every 30 minutes using a dot. For example, pulse, which is 80 beats per minute, will be recorded here. And blood pressure is recorded every 2 hours using arrows. For example, blood pressure reading of 120 over 70 millimeters of mercury will be recorded here. And temperature is recorded every 4 hours. For example, temperature of 36 degrees will be recorded here. And urinalysis is done every time urine is passed. For example, on admission will be recorded here. Now done recording our first findings, and as you can see, all our findings are recorded on the vertical line, which represent 01 AM. Fetal heart rate, contractions, and maternal pulse are recorded every after 30 minutes. Now we record findings on the second vaginal examination with 9 centimeters cervical dilatation, descent 2/5, membranes ruptured with clear liquor, and Modin +1. We'll continue recording the findings until the woman delivers. After she has delivered, we close the partograph by writing the summary of the delivery, noting the APGAR score, date of birth, time of birth, birth weight, and the sex. On my next video, I'll talk about how to interpret the partograph. And thank you for watching. Remember to subscribe to my YouTube channel. Thank you for your support.